Professional Issues presentation by Gillian Robinson. Nursing shortage. Nurses make up the largest group of healthcare professionals that provide direct care. An improved economy is making it easier for nurses to once again leave the workforce. Nurses are also leaving the field due to feelings of dissatisfaction in their work environments. Federal healthcare reform and the aging baby boomer population are increasing the amount of patients needing to be cared for. The Robert Wood Johnson Foundation has estimated a shortage of over 1 million nurses by 2020. Robinson. The Robert Wood Johnson Foundation, RWJF, is committed to expanding the number of nurses, building their leadership capacity, sharpening their skills and the skills of their educators, and building awareness of the urgent need to address the projected nursing shortage. The Institute of Medicine, IOM, report is the work of the RWJF committee. In the report, 4 key messages and 8 recommendations to achieve these key messages/goals is outlined. Key message. Nurses should achieve higher levels of education and training through an improved education system that promotes seamless academic progression. To achieve this key message, healthcare organizations are reviewing the Institute of Medicine recommendation number 3, implement nurse residency programs. Nurse residency programs were first explored in 1984 by Patricia Benner. She believed in evolving a nursing graduate into a competent nurse. Her work offered a variety of solutions in preparing the nursing graduate. Currently, the recommendations by the IOM is not firmly outlined and there is frequently confusion between nurse residency programs and nursing orientation. According to the IOM, healthcare organizations and foundations should be responsible for evaluating the effectiveness of the residency program through improved nurse retention rates, strengthen nurse competencies and enhance patient outcomes. Why implement a nurse residency program? A nurse residency program is more than transitioning a nurse from one role to another. It's a development tool for the entire organization due to the systemic nature of residency, which incorporates and engages not only an individual's preparation into practice but also the preceptors, but also the classroom instructors, and debriefing facilitators within the organization who work with the resident. Stanton, 2011. Stanton. Stressors of being a new nurse. Stressors of being a new nurse can be a very stressful time for any nursing can be a very stressful time for any nurses experience high levels of stress. Often new nurses experience high levels of stress, satisfaction lack of confidence and decreased satisfaction around 6 months after their hire date due to orientation endings. Lateral abuse from fellow co-workers and unreasonable abuse from fellow co-workers already high level of stress contribute to this already high nurse residency programs create competent nurses. Nurse residency programs are designed to limit the stress-causing factors. Nurse residency programs help new nurses enhance communication with physicians/fellow co-workers as well as equipping these new nurses with techniques to resolve lateral violence situations if they were to arise. Along with communication, critical thinking, and reasoning skills, the use of evidence-based practice are developed. Organizational skills such as priority setting, time management, and delegation are deepened. Lastly, by the end of the program, the new nurse will hopefully be molded into a professional leader and will have the tools to achieve advancements within the organization. How nurse residency programs work. Generally, nurse residency programs are a year in length but can vary. Typically they consist of a 4-hour monthly meeting that is mandatory, pre-scheduled, and paid. All newly licensed nurses throughout the hospital must attend, including nurses who are in critical care settings. Towards the completion of the program, usually an evidence-based project by the new nursing staff is required. Customarily, the nursing education department in the hospital is in charge of developing, implementing, and evaluating the program. Cost-benefits of nurse residency programs. The total cost of graduate nurse turnover is estimated to be between $49,000 and $92,000 per nurse. CAPEL 2013. University of Pittsburgh Medical Center, which offers an organization-specific program, reports a decreased turnover rate within 12 months of hire, from 15.4% 2008 to 8.1% 2012, with an associated savings of $1.2 million annually. 2012, CAPEL 2013. My own experience personally, I am a product of a nurse residency program. I received my RN right after turning 22 years old. At the time, I had no real-life experiences. I began working at a Level 1 trauma center in upstate New York and was enrolled in one of the first nurse residency program at that hospital. While in the program, I strongly disliked it because I had a very unsupportive manager who would not schedule me appropriately for the meetings. Often once a month I would have to work 7 p.m. to 7:30 a.m. and afterwards go to the meetings from 8 a.m. to 12 p.m. and then return back to work that night. However, after voicing my concerns to the educational department at the hospital that ran the program, my scheduling problems were quickly fixed and I learned how they were an excellent resource for me. Questions. Have you participated in a nurse residency program or have known someone who has? If so, what do you believe are the benefits/downfalls of the program? If you are in management, does your hospital have a nurse residency program? If so, what are the barriers to having a new nurse enrolled in the program on your unit?